Hello everyone, my name is Jesseline Mundo from Davao Doctors College, and for today I'll be performing the infant cardiopulmonary resuscitation. So first things first, as we know that our patient is an infant, we have to evaluate first the newborn's transition to the extrauterine life using the Apgar score. So the Apgar score will help us determine if the baby is healthy or the baby is in a constraining situation. So next, is that we are going to check for responsiveness by rubbing the sole of the feet of the baby or rubbing the back of the baby. So we are going to rub the sole of the feet just like this to see if the baby will react or we can see any response. So if there is no response, we are going to position the newborn on his back and call for help or activate the code blue or Dr. Squeak by shouting, Dr. Squeak! Dr. Squeak! Okay, so after getting the attention of other nurses or quality physician, we are going to open the airway and suction the excessive secretions if necessary. And then after that, we are going to perform the positive pressure ventilation or the PPV using the pediatric bug valve mask or the BVM. So I have here my improvised bag valve mask. So we are going to attach this to the oxygen cylinder with 100% oxygen. And then we are going to cover the entire mouth and nose of the infant with our BVM, and then we are going to provide ventilation every 1 to 3 seconds for 40 to 60 BPM. Okay, and then we are going to have someone to attach the cardiac monitor and pulse oximeter. So let's say that this is already attached to the infant. So now we are going to do the gentle chest compression. If the heart rate is still less than 60 beats per minute after 30 seconds of PPV. So we are going to use either two finger or two thumb encircling technique when doing the compression. So we are going to place our compression fingers at the center of the chest, just below the nipple. So we are just going to um, determine the line of the nipple, and then we're going to locate the center of it. So we are going to do the compressions here. Okay, so we are going to press on approximately 1/3 the depth of the chest or about 1.5 inches. Okay, so now we are going to provide the 15 to compressions ventilation ratio for about 10 cycles, which should be done by two rescuers. But since I am only the one who's doing this, I'm going to compress first before giving two ventilations to my patient. So we are just going to do the compressions now. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then we are going to do the two ventilations. 1, 2, 2. And then we are going to do again these compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then two ventilations again. 1, 2. Okay, so if the heart rate of our patient is still less than 60, we're going to continue the chest compression up until 10, and then we're going to assist the intubation and giving medication to our patient. So now if the heart rate is more than 110 beats per minute already, we are going to proceed on the next step, which is we are going to do the post-resuscitation care, which is we are going to continue monitoring the pulse oximeter, the heart rate, and also the rhythm of our patient. We are also going to make sure that the patient is getting adequate oxygenation and ventilation. So let's say that my patient has already has a stable heartbeat and has getting enough oxygenation. Now we are going to document the time, the procedure, the assessment, and also the response of the patient to the treatment that we have given, and also the medications. So that's all for the infant cardiopulmonary resuscitation. Thank you for watching.